Welcome back. As Canada's COVID-19 death toll surpasses 20,000, nurses across the province say they are reaching a breaking point, with many even considering leaving the profession. Diane Martin, CEO of the Registered Practical Nurses Association of Ontario, joins me now with this troubling new study and what is pushing these frontline heroes to the boiling point. And I'm saying that term frontline heroes, Diane, because here's the tough part. When we say heroes, that puts a real pressure on those on the front lines and makes it even more difficult. Good morning to you.
Good morning, and thanks for having me.
Thank you. So let's talk about this study of a number of nurses that was looked at and just seeing where they're at right now and how they're doing.
So we surveyed just under 1,000 nurses, 800 maybe nurses, and we asked them about their experiences. We'd been hearing about them, and we wanted to know the stories we were hearing, how pervasive are they? And we were shocked with the results.
So we're looking at some of the survey results on our screen right now. 71% experiencing a breaking point, 90% workload has increased, 96% daily work has become more stressful. We see this trend here, but interesting, 34% have considered leaving the profession entirely. Now that has got to be troubling.
Yeah, that number is shocking because my mom was a nurse. My daughter's a nurse as well. It's a family of nurses. And it's always been something that people did for life. You became a nurse and you nursed your entire life. You maybe changed position, but you be a nurse because I've always felt it was the most rewarding job. But we are at a point now where nurses are saying there's a limit of time that I can take this on. So that's very concerning when that starts to happen.
Diane, I've been reading a lot of accounts from nurses who are there for the moments of the final goodbyes in hospitals. And it's heartbreaking because what many people may not know is, you don't get to have the family to sit at the bedside of someone who is passing from COVID-19. And sometimes it's being done via an iPad and via video, and nurses holding hands in those final moments. And that has got to take a toll on them.
And it's not just our hospital nurses. Long-term care nurses are doing this day in and day out right now. It's anywhere that there are COVID patients. And supporting people through death is part of our job. But supporting people through death when they're experiencing a trauma from separation from their family and when their families are so traumatized as well, being separated, that the toll it takes on nurses is even greater.
Absolutely. And Diane, when we think about this, nurses, a lot of them going home to their very own families and having that and carrying that with them, and a lot of them choosing to separate so that they're not potentially spreading something with COVID-19. And so what is that like to be a nurse, but also, say, a wife, a mom, and having to carry all of that?
Well, I think that what we usually do when we have a stressful day at work as a nurse is we go home to our families, and our families get it, and our families are what get us over it. I remember when I was having tough days as nurses back in my day, I would come home and I would be so centered by my children. Mm-hmm. They would make me feel quite centered. And now I have my nurse daughter works in critical care. She lives here, but I have moved to somewhere else where I can be isolated from her at her request. So, it's a lot of loneliness, and a lot of the supports that keep us going are gone.
So what do we do now? Okay, is there a push right now to get some of those supports back?
Yeah, unfortunately, there are some supports out there, but unfortunately they are so poorly communicated. I'm just finding out about them now since we've done the survey and publicized it. People are calling with programs that nurses can access and that sort of thing. But really, I think what's really important is that we manage the causes where we can. We can't fix the disease, the nature of the disease, but we can have the public stay home. Mm-hmm. And reduce the numbers. We can have the government ensure that nurses don't go without pay for 2 weeks because they've had a positive COVID test after working in a COVID nursing home. There's so many things that could be fixed to alleviate some pressure.
I come from a family where my mom was a nurse, and I have the greatest appreciation for everything that all of our nurses do, especially during this time. I want to put up a board here. We have some phone numbers if anyone needs to contact when it comes to distress lines, and we're going to put that up on our website as well. Thank you so much for all the work that all of our nurses do in every single environment, the hospitals, the long-term care homes. Thank you, and you are very much appreciated.
Thank you, Melanie. Thank you for that.
Take care of yourself. All right, 6:24 is your time right now. Still to come here on BT, we're talking COVID-19 in Australia. They're putting an entire state, over 2 million people, into lockdown. We'll tell you which one and how long this is going to take. We're going to take a look at all the headlines around the world coming up.